Hi, good day everyone. I'm Dr. Laureen Conanan, expert in psychiatry and behavioral medicine and affiliated with Level Doctors Hospital. October is Mental Health Month. So this month we're going to focus on a topic that everyone actually feels but then a lot of times is also misunderstood. So what I'm going to talk about is the basic common questions about anxiety, looking at whether it's normal or when it becomes a cause for medical concern, talking about the different types of anxiety disorders and whether they're just all in the mind or is there a biological basis. I'll focus a bit on treatment and I'll end with some tips on stress management and handling anxiety. The words or phrases that are often used to describe anxiety are worried, stressed, sa Bisaya pa, nervyoso, sige kag-uol, bisag walay kaguluhan, mabalak-anon, pirmi, kadluhan, dali makuratan, himantayon sa ngatanan. So these are some of the words that we use for anxiety. Yeah, so what exactly is anxiety? It's a diffuse, unpleasant, vague sense of apprehension accompanied by what we call autonomic symptoms. And these symptoms are usually when your body is in an emergency mode. So you have headache, respiration, palpitation, chest tightness, mild stomach discomfort, or restlessness. These are just some of the symptoms. So what's the difference between worry and anxiety? Sometimes they're interchanged, but usually worry relates to the thought or concern of what they're thinking about. Like, I have allergic rhinitis. How will I distinguish this from COVID? So you start getting worried, And anxiety is the resulting emotion that comes with worry. So like every time you cough, because akala mo meron kang allergic rhinitis. So even if you didn't leave home for the past 4 days or was isolated, then you get anxious that alaka, baka magka-COVID ako. That's the difference. Yeah, people say, pero normal man na, ma-anxious man yun ta. Diba? True, it is normal, it's a normal and adaptive response. Because when you're anxious, like for example, you're anxious when you get into the hospital and you might catch COVID. So this prompts you to make the necessary steps to prevent or lessen the consequences. So this prompts you to wear a mask, to social distance, to avoid gatherings, or to stay home. And you also thinking ahead is normal man. Kay kinahanglan kabalo ko unsay mahitabo. If there's an earthquake, I should have my bag with me. So that's normal. It's adaptive. So that also means that it's adaptive when you're taking sensible precautions. Okay? How about anxiety and fear? What's the difference? Anxiety and fear are both alerting signals, meaning they act as warning that there's an impending danger and that there's a threat. In anxiety, however, usually the threat is more internal. It's unknown. Di ko kabalo anong di ko mahimutang. It's internal, it's vague, and it's conflictful. So, you're restless, you're worried, na duwa man kakabaloon sa imong worry. Whereas in fear, what the threat is usually known. It's external, it's definite. So you're afraid of a snake because you see it there, it's gonna bite you. And it's usually sudden. Whereas with anxiety, it's insidious. Parang it comes in very slowly lang. Before you know it, you're always worrying, you're always anxious. Okay? So stress and anxiety, this is also interchangeable sometimes. They used interchangeably. When you say you're stressed or you see see an event as stressful, that actually depends on a lot of things, no? It's the nature of the event. For example, it's sudden, unexpected death, unexpected isolation. It depends on your resources, the person's resources, no? Meron ba siyang support system? May kababayan ba siya kung magkasakit siya? It also depends on the psychological defenses. Example, if some people, when they're under stress or they have crises or challenges, they're able to cope. They're able to say, okay, this is part of life. They're able to rationalize it to themselves na, okay, so this is what's happening now. This is what I will do. Or they're able to sublimate, like, okay, instead of getting worried about something they cannot control, they do crafts, they pray, they play music, they video games, or learn something new, no? Or they have coping mechanisms. So it depends on how you perceive the stress, depending also on all this, the nature of the event, personal resources, psychological defenses, and coping mechanisms. So if there's an imbalance there, that's when it leads to anxiety. So meaning, di na kaya yung usual na style ng pagdala ng mga problema. No? It also depends on when there's an imbalance in your impulses. No? Dali ka na magalit, hindi ka na makafocus, hindi ka na makadecide kung ano na lang gagawin mo. So when there's an imbalance there, then that leads to an anxiety. For example, in the office, if there's a demanding boss who calls you anytime, especially now, work from home, so wala nang work hours, they call you at 12 midnight, but they pay well, and you know a lot of people who are losing jobs. So you have to balance yung, nakakainis tong boss na to, with, I have to be practical, I have to keep my job. And that, too much of that will lead to anxiety. So that's one example about stress and the relationship between stress and anxiety. So people say, nasa naisip ko lang yun eh. No? But there is a biological basis of stress leading to anxiety. I won't go into the details of it much, but the hypothalamic pituitary adrenal axis and its relationship with what we call cortisol causes the arousal response of the body. No? So when you're alerted, or say there's a fire, you get aroused, no? So you're more focused, you're more vigilant, and then there's a containment of your immune system. Meaning that the body does react to stress. There is a biological basis for it. Normally, pag wala na yung stress, mawawala. But if you're constantly under stress, then that's when problems start to happen, because your body can only take so much. Okay? Your biology. So when do you say, okay, so it's adaptive. So it's related to stress. We all have stress. So, well, when do you say it's no longer normal? One would be when people are worrying excessively about things that other people don't seem to worry about. Like constantly worrying about things that may never happen or have little evidence of happening. No? Okay, like when we had the earthquake, everybody was worrying that halaka, nano po yung earthquake shock, aftershocks. Pero some people got to a point na lahat na lang, kahit wala na o walang alarm or notice, sige gihapon worry, sige gihapon kahadlo. No? So the evidence is no longer proportionate with the reaction. Also, when people start worrying and mistaking it for caring. So an example would be a mother who keeps worrying about her children's safety and constantly calls them even when they're at work, constantly checks on them, wants them to be home na right away. And yet, wala namang ebidensya na they're not safe. And yet, her worries, they're not safe. So she has to keep checking on them. I think what's important here is that you have to realize that Anxiety involves your thoughts, what you're thinking, involves your feelings, involves the bodily reaction, the physical reactions of your body, and your behavior. So, when you ask, kailan hindi na siya normal, no? Bakit parang iba na yung takbo na isip, no? Like I was saying, you're worrying more than you should, you're mistaking worrying for caring. The kinds of thoughts that happen there are what we call cognitive errors, no? One very common example of thoughts, anxiety thoughts, is what we call catastrophic thinking, where you imagine catastrophic events or outcomes during seemingly normal experiences. Meaning, palaging worst case scenario ang inisip. Na, to a point na even the people around them, unsa man ka, uy, wala may mahitabo. No? But worst case scenario lang din siya palagi ang mode niya. Also, mind reading, no? Thoughts that predict the other people's thoughts or responses. Na, di na ako mag-attend o party, bisag best friend na ako na, or favorite pamangkin na ako na, kay walain unya ilang tanaw sa ako, ang ilang conclusion kay lahi na gyud ko, you know. So they have all these predictions about what other people feel or think, but they will not actually be able to control that, no? Or disqualifying the positive, na nakatulo na siya kay ECG, na normal tanan, nakaadto na siya daghan specialist, pero dili gihapon niya tuuhan na nag-ingon man ang doktor, wala may physical nga diferensya sa imo, di man ka ma-heart attack, okay man daw imong heart. So these are the kinds of cognitive errors that happen when we start to say, mukhang hindi na yata to okay. How about feelings? Normally, somebody who is overly anxious or who may be needing medical help as far as anxiety is always irritable, moody, restless, on edge, can't relax. They're always overwhelmed, and even to themselves, so, hindi mo ko yung ani sa una, no? They get easily ashamed, they feel guilty, they feel self-pity, they feel helpless because of the things that they're thinking of, the catastrophic thoughts, or the mind-reading thoughts, or the disqualifying positive thoughts. Aside from the thoughts and feelings, then they also have physical, like I said, they have physical reactions and behavioral reactions. Ano naman yung nangyayari sa katawan mo pag sobra kang anxious, sobra kang worried? So the worry will cause anxious emotion that will cause your body to react. And how does it manifest? It's generally, like I was saying earlier, arousal, no, of the autonomic nervous system. That's why you have sweating, nausea, headache, tension, kasukaon, magkurog-kurog, palipo nga di kasabot, di na nako makita, murag tunnel vision na, your heart pounding, palpitations, flushing, dry mouth, or sige ihi-ihi. No, this is how your body reacts during an emergency mode, even if there's no emergency. But because in your thoughts, it is an emergency, you'll have a heart attack, you might collapse, you might have a stroke. So, because of that, you have behavioral manifestations. Worrying will interfere with your work. Sige na kag-absent. No? With your relationships, sige na lang, dili lang ka sa akong tapat. No? Wouldn't want your children or your husband to leave. And so that will affect relationships. And it affects activities of daily living. That if you're alone, you can't do things that you normally would be able to do. Also, it leads to avoidance behavior. So, you avoid going to work, you avoid all sorts of food because you think it will trigger. You avoid places. Di na ka mo adtog simbahan kay daw bi makolaps ko dito. Di na ko mo adtog mall kay daw bi walay motabang sa ako dito kung magpanik ko, no? That sort of things. There's avoidance behavior. There's also safety behavior. Like I was saying earlier, you mistake worrying for caring. So, you always have something in your bag. I have patients who's naagad sila tubig, naagad sila biskuit, naagad sila kanon gani, no? Para safe lang din sila, no? Kung sila ay mahitabo, na sila ay madaganan, no? Removing all distractions. So, di ko gusto og sambo. So, they don't want the children playing there. Di ko gusto og saba. They don't want the TV on. They don't want the radio on. And yun, they also feel helpless. So, they have other people do things for them. Ikaw nalahimoan na. And they avoid touching something. So these are some of the behavioral indicators. And as you can see, if a patient behaves that way, then it definitely affects already relationships and daily living. So a lot of times, this kind of thinking, feeling, this kind of complaining about physical symptoms, and this kind of behavior will make the people around them or even the doctors that they go to sa, wala ba yung problema sa imo? Tayo mo lang ng huna-huna, no? But no, there is actually a biological basis for it, because like I said, there's a relationship between stress and anxiety, and your body has normal reactions to stress. And so if this is overstress, if there's the emergency mode that is on too long, then you're going to have symptoms. Okay? This is actually an interplay between genetic and experiential factors. Because like for example, you go to a doctor, the doctor says, hala, murag taas ra ba? Murag dako ra ba ang imong heart? Murag nga ay enlargement. Even if it's not a significant finding, that will start making the person become always conscious na, hala ka, baka ma-heart attack ko. And so, the biological aspect there is there's an autonomic nervous system arousal. No? The body is always in emergency mode. There's also such thing as neurotransmitter dysregulation. We hear about norepinephrine, serotonin, GABA, and these are the chemicals in your brain that get dysregulated when your autonomic nervous system is also always on an emergency mode. That also works with the HPA axis, the hypothalamic pituitary adrenal axis, which is activated. It increases the release of cortisol. That's normal. It helps us adapt. It makes you carry a refrigerator when there's a fire. But if that's always on emergency mode again, and it doesn't go down to normal, then you start to have anxiety symptoms. Okay? So there is a biological basis for it. So when should you suspect that it might be an anxiety disorder? When we say anxiety disorder, that means it already is an illness and there's already reason for medical attention. No? So like for example, acute episodes of anxiety with or without avoidance of the feared situation. No? So if it's a specific person or object or situation that they're afraid of, then it is what we call a specific phobia. No? Like for example, fear of heights, or people who are afraid of taking the airplane. So that's a specific phobia. It can also be an acute anxiety associated with a social or performance situation. Na bright magunta siya manunta gipili sa teacher para mag-lecture or para mag-report. But once he's in front of people, then he starts getting all sorts of symptoms and is unable to perform. This is what might be social anxiety disorder. Sad. No? It's a phobia, but it's a performance phobia. There's also acute phobia where the initial episode is panic. No? So that's what we call a panic disorder. Suddenly lang nandun siya nagdadrive siya, and then traffic, hindi siya makaalis kaagad. Bigla siyang magpapanik for no reason. And then magkabuhit na, di na makadrive, malito na, and it feels like he's going to have a catastrophic event. That's what we call a panic disorder. These are the ones that usually end up in the emergency room. So you suspect also if there's uncontrollable worry or tension. You remember, I'm sure you know people who, sige lang worry, no? All sorts of things they worry about, even if there's no sensible reason to worry about them. This is when you might suspect GAD, generalized anxiety disorder. So there are two other conditions, although they're no longer considered anxiety disorders because they've been separated, but they're actually also very much manifesting as anxiety. That's when you have obsessions and compulsions, so you have to think of obsessive compulsive disorder, or when there's trauma, where even when the trauma is no longer there, it keeps recurring in their minds, and this is what we call PTSD, no? Post-traumatic stress disorder. So in those situations, you would suspect that, okay, this might be an anxiety disorder. As you can see, there are different types of anxiety disorder. We have what we call panic attacks. We have agoraphobia, is where you're afraid to go out or to go places. Specific phobia, like fear of riding planes. Social anxiety disorder, and generalized anxiety disorder. They're quite common actually. 1 in 4 people have an anxiety disorder. So when anxiety disorders, they have a lot of things in common. They will manifest with sleep problems, with concentration problems, that's why they nakafocus. With fatigue, they're always tired, so that's why they think they're sick. So the anxiety disorders have a lot in common, no? So it affects sleep, concentration, you feel weak, you're aroused. But then, depending on the kind of anxiety disorder, you can have panic attacks, you can have phobic avoidance in social anxiety disorder or specific phobia, you can have compulsions in OCD, you can have also phobic avoidance in PTSD. So there's an overlap, but the central manifestation would be anxiety and worry. Okay? So in panic attack, there's anticipation or anxiety or fear of specific event, of something happening to you. So it's unexpected panic attacks, and then so that leads to phobic avoidance. And then in panic attacks, we hear people say they feel like they're going crazy. That's actually what makes them avoid or become very fearful. That's because panic attacks are sudden. They may or may not have a trigger. They're very overwhelming. So feeling mo mabuang na ka or lose control. No? And then in GAD, which is quite common, there you don't have the panic attacks, or you may not have that much phobic avoidance or compulsions, but you have the other symptoms. No? Said PTSD and OCD are no longer considered anxiety disorders. They used to be, but they also manifest with anxiety. Okay? So in panic avoidance, in PTSD, it's more avoidance and arousal and a difficulty of sleep because they remember the traumatic event. In OCD, there's a lot of rituals, no? The compulsions. Like, OCD is very under-recognized because people do not ask, doctors do not ask, and people are ashamed to talk about it. Like, do you wash or clean a lot? Do you check a lot? Is there a thought that keeps bothering you na, halaka, baka hurt ko somebody, or halaka, baka ma-aksidente, or whatever. Those are intrusive thoughts, no? And it takes so long for you to finish because you have to keep repeating, or you're too concerned with orderliness or symmetry. No? In SAD, in anxiety, social anxiety disorder naman, because he has to face people, he's stuttering, there's palpitation, butterflies in his stomach, blushing, sweating, trembling. Okay? And it's sad because it's a missed opportunity for treatment. You can treat people with SAD. 64% do not seek medical consultation. There are celebrities like Barbara Streisand, who is said to have social anxiety disorder, and even Pope Benedict. There's actually a whole overlap between the two. So the symptoms can be similar. In depression though, it's more the depressed mood, walang gana. In anxiety, it's more worrying and worrying. No? Fortunately, there's treatment. It's just that people don't recognize it, they don't seek help, or they don't believe that there is treatment, or that the treatment works. Medications work quite well. And that's the other thing. Antidepressants are also very good anti-anxiety drugs. They're not addicting. But then it's important also to do psychoeducation. You have to understand what anxiety is and what you're going through. Ana di ay na dugay na kay nako ni gibati. Dugay na di ay ko dapat nagpatambal, no? Then supportive psychotherapy kay malagot naman ang mga asawa kay di man pahawaon, mga anak malagot na pod kay sige tawag, you know. So you have to do supportive psychotherapy for them to understand what they're going through and how they're going to deal with it, and also for the family. CBT, cognitive behavioral therapy, is now very popular in treating anxiety. Like I was mentioning earlier, the kinds of cognitive errors, no, are first of all you're made to recognize them, and you're given strategies on how to reverse that. Because there's a cycle of thought, then your feelings, then your body's reaction, and your behavior. So that whole cycle. You do relaxation exercises. It's not just placebo to say, maghinga malalim at mag-inhale, exhale. But if you do it properly, it actually reverses. Kasi your muscles relax, there's less acid in your stomach, there's more oxygen in your brain, and so that helps you relax. And it averts the panic attacks. And there are other behavioral strategies like yoga, mindfulness, all this help. Unfortunately, anxiety, when you see them, they've been there since childhood, many years. And so, treatment is usually long-term, but it's not necessarily forever. It involves like the treatment methods I mentioned and strengthening the patient's coping skills, but more also on preventing relapses. Because if they know na a panic attack lang ni dili ni heart attack, then they can deal with it better. So I'd like to end with 4 just basic strategies on stress management. I'll go through them very briefly. 1 is build up your health. These are not rocket science. These are some basic things, but we forget to do them. Build up your health, your nutrition, eat the right food, take rest. Sa karon panahon na kay wala na may rest, kay ang adlaw gabi kay sige mag-internet, sige video, sige telepono. You still need rest for your immune system. You need to exercise instead of just being glued on your phone all the time, and you have to have good health practices. Yon. We all know that, but we just ignore them, or we just don't think they're important enough. Change the situation. Okay, if there's a source of stress and you cannot control the source of stress, but you can change the situation for yourself. Okay? I'm not telling you to change your husband or change your job, but there's a lot of ways by which you can change your situation. You can also change your mind. No? Change the kinds of thoughts you have. This is what we teach in CBT. Your thoughts and your perceptions about the event are the ones that cause you to be stressed. Okay? And then change your body. This is where we have relaxation exercises, mindfulness, inhale, exhale, where you substitute relaxation with tension. Okay? So they're very basic. Change your body, change your mind. So we have what we call the calm model for stress. So it's easy to remember. To remain calm, just remember this C for change. Prevent stress, you confront the stressor, ask for help, you manage your time, and learn to say no, learn to take a break, you anticipate the stressor. So change, C. A is learn to accept. You can't change everything all the time. You have to accept that, first of all, that you're thinking irrationally, that you're not making sense anymore. And you have to handle your anger. Don't make it worse by making everybody else around you stressed na dili lang ka, di ka magawas, uli og sayo, you know, you have to let go. There are a lot of things we need to let go. We have to let go of always thinking about getting rich. We have to let go of all these things that we don't need. We have to let go of all these thoughts that actually make us feel restless. Because if you let go, then there's more balance, there's more resilience. Our model for stress management is C for change, A for accept, L for let go, and M for managing your lifestyle. So with these thoughts, I hope that we can work more on resilience. It's a challenging time for all of us, but COVID or no COVID, the CALM model and the 4 strategies for stress management will be helpful. Thank you.